In fairness, I should give the gentleman from Louisiana a chance to respond since he attempted to do so, and then I'll recognize the gentleman from District of Columbia and anyone else who wants to comment.
Sure. Well, let me say parenthetically that a study just came out today that I believe 83% of physicians, when asked, when polled, this was a survey, a scientific survey, said they are reconsidering their occupation. So, and I can tell you that I get questions a lot from medical students who ask me, did they do the right thing? So, again, I would just say to the gentleman that right now, Obamacare means for healthcare workers a very uncertain future. Yes, they do want to take care of patients, insured or not, but they see a very dark cloud ahead of them. But to respond to your statement, yes, sir, you did say access to care. That is the actual term, and I'm sure we could pull it up in the transcript if we need to. And why that is important is because that is a common myth. Whether or not the gentleman meant it or not is beside the point. The point I needed to make with that is that Americans are getting that message, that once you get that card, that means that you go into the healthcare system and you're just going to be taken care of, and that is the whole point. Half of the additionally covered Americans under Obamacare, and this is by Democrat numbers, not mine. I think fewer are going to be covered than the 30 million that are claimed, but half of them will be covered under Medicaid. And you just heard the gentleman from Maryland say that very few doctors accept Medicaid, not because they don't want to accept Medicaid, because they can't afford to accept Medicaid. If we don't deal with the cost realities that go with malpractice insurance and all of that, the access problem is going to only get worse. So I think that's something we need to leave with today, that just because you have a card, just because you're in a system, does not mean you have access. And I yield back.